Hey everyone, welcome. We'll go ahead and go and get started. If you are a clinical student at a hospital site here to represent the hospital you're at, please just drop your location in the chat just so the basic or the medical science students kind of know where you're at. And for the medical science students, please come on and just ask us any questions you have, regardless if it's at a site or you're interested in a particular site. Someone's here to be able to talk about it. Okay, so this event's really for the medical science students. So if you guys have any questions, just, feel free to either drop them in the chat or come on the mic. You don't have to turn your video on if you don't want to. If not, I'm going to be staring at Assam Kayla for the next couple of minutes. Would you guys prefer for us to just kind of start talking about our sites a little bit? Yes. Okay. Okay, so let's start with Mount Sinai.
What's up, everybody? Mohammed, third year med student at Mount Sinai. Um, I don't know where I should start, honestly. We don't have Epic. That's one thing I could tell you. We got Meditech and Next Gen, so it's a little bit different than most people are used to. Um, and usually, when you start your rotation, you'll be with other students that already had rotations in that hospital. So it kind of helps you guys. They'll help you on your first week or two get familiar with the hospital and like Meditech and Next Gen, which is the EMR we use. But it's not too hard. One thing I would tell you, um, I wish I would have done before I started my clinical rotations is focused on your SOAP note and your physical exams. I was like trying to study everything and, trying to get my knowledge, on point. But that's something that you have the knowledge already. You took step one. Um, and it doesn't matter how much knowledge you have, when it's different when you apply it and when you see it in practice, and that's something you're just going to get better at as time goes. So before you start rotations, I highly recommend just going over soap notes and physical exams, because that's one thing that will make you stand out on rounds, is like what to look for each pathology and each clinical presentation. So you can put it in your note, and so when you present it to your attending or your resident, they kind of have an idea of what you're kind of thinking of, as far as the differential diagnosis you have, so you can exclude certain things and you'll have like a preferred differential on top. um, if you're starting in surgery, we do have a pre-orientation workshop. Usually I'll meet all the students the weekend before you guys start, and I'll show you the floor, show you the list, I'll show you everything in the hospital so you can get familiar with the hospital and where to go. And even if you're not starting in surgery, you can just contact me. There's some students that started at Sinai and like psych or OB or whatever, and I'll just tell them, once you get your fit test done at the hospital, just contact me and I'll meet you on the floor and I can show you Meditech, I can show you Next Gen, I can show you around the hospital. So on your first day, you're not completely lost. And fit test is just you'll go in there, you'll get your parking pass, your student ID, and then they'll fit you for N95. I remember when I saw that email, I was like, "What the hell is a fit test?" So it's nothing too big, but you'll get access to everything on that day, and try to do it before your orientation day on Monday, so you don't have to do that on your first day of clinical rotations. To save you a lot of time, and also you can kind of get familiar with the hospital um, before you start. And when you do that, then you can, come to the hospital and get on a computer and look at things. But other than that, if you have any questions, um, yeah, just put it in the chat. I don't know if anything else I should add, honestly. That's a tough question because it depends on your rotation. It depends on your residence. Um, like I have a friend today, she didn't have to go in. Tomorrow she doesn't have to go in because she has, a resident. It's like, oh, stay home and study. Um, but some, rotations expect more of you, like in surgery. I started off in surgery. I'm in my second core right now, internal medicine and surgery. Get there at 5 in the morning. You could be leaving at like 4 p.m., 6 p.m., depending if you have clinic in the afternoon. Depending if you're in the OR, so you got a case starting at 3 o'clock, it might, run a little late. There's nights I've left at 11 p.m., I have to be back at 5 a.m., but that's not like an everyday thing. So it kind of really depends on the rotation and where you're at. And if you come to Chicago at Mount Sinai, you also rotate at Holy Cross Hospital, which is kind of like 8 miles down the street. And that's a little bit more of they say a chiller rotation. You do specialties over there. So like right now I'm there. I'll come around like 9 p.m. Today I left at like 2 p.m. So it's different. So when you're at Sinai, you're coming in around like 6 a.m. and then you might leave at 4 p.m. So it kind of depends, really what your residence and the rotation you're in. Oh yeah, I love Mount Sinai. Honestly, you'll see everything under the sun. Every patient has everything under the sun. The patient population is a little bit different than what you'll usually see. Um, it's a government-funded hospital, so you get a lot of experience, a lot of hands-on. As long as you're engaged and really want to, um, you know, if you ask questions and stuff, the residents are really, helpful, and they'll be like, if you want to do something, just ask. They're willing to let you do stuff. So, um, as long as you have, engagement and drive and ambition, they'll open the floor for you and let you do whatever you really want. Um, it's Meditech and Next Gen. So when you're in clinic, you'll use this EMR called Next Gen, and that's where you'll put your notes in. So in clinic, you're responsible for writing your HPI, your physical exam findings, and then also some attendings want you to write an assessment as well. So That's why I say make sure your soap note you practice your soap note before your rotations, because it's going to be very, very important. I remember my first day in the hospital. Honestly, it was probably like my worst day of my medical career. I was lost, um, and that's why I really like this event right here, is because we're all a team at the end of the day. Whether you're a M4 or M1, whatever you are, wherever you are in the journey, we're all in it together. So. I'm willing to help you guys before your first day. Make sure you guys are a lot more comfortable on your first day if you do come to Sinai or Holy Cross. They will be switching to Epic in September, but supposedly it's been like that for like 2 years. So who knows if they're going to be switching September, but the goal is for Mount Sinai to switch to Epic in September. I know a lot of attendings and nurses are doing training for it, so cross our fingers and hope that that happens. How difficult is it to get an A? I think it depends on the student. If you're really like if you're interested in one specialty, like say you're interested in surgery, you got to give it all in psych. You got to give it all in IM. You got to give it all in every rotation you have. And if you do that and you're on time, um, what they look at, they don't expect a lot out of you except for progression. If you start on your first day and you don't know much, but on your last week of rotation, the residents and attendings saw that you showed a lot of progression. That's all they really care about as a third year med student. As a fourth year, it's a little bit different. You're required a lot more out of you, but as a third year, as long as you're engaged and there and asking questions and always want to be involved, I don't want to say you're going to get an A, but most likely you'll get a good grade. Shelf exams, not gonna lie, I've taken one and they're not easy. I'll say that they're not easy. um yes, UWorld is great. There's a Emma Holiday. I'm pretty sure people in rotations have heard about Emma Holiday. Highly recommend her videos, highly recommend her slides. Divine Intervention is another one. Dr. High Yield is another one. So if you do UWorld, you watch those videos, you go over those slides for those three people, and you do your MBME exams, and you're really like focusing on like your patients in the hospital, you learn a lot about like you learn a lot of knowledge through your patients, like management. How are we assessing this? Like, what meds do we need to give? What meds should we not give? So if you're really in it every single rotation, um, you should do well on your shelf. And it's honestly like it's like 66 or 67% on a shelf to get like an A for the like the shelf exam. And you have to do your evaluations, and then the surgery the clerkship director will give you like a grade as well. So if you do well on your shelf, you do your evaluations, and you're engaged, then you should get a good grade from your clerkship director, and you should get an A. I don't see why not. Um, does each site have a designated time off during the year? Um, we just have, I don't know if this is like a site specific thing, but I know at Chicago in December, we have 2 weeks off. Um, and I don't know if all the students know, but I heard it. Some students were talking about it, and I looked at my schedule, and I do have like the end of December, the 2 weeks at the end of December off. So, but usually you'll just go from one rotation straight into the next one. Um, you'll just have like a weekend off. Highly recommend taking your shelf on that weekend. Um, and if you do take your shelf during the weekday, you're the Ross rule is that you're excused the day before at 1 p.m. You just got to make sure your residents and attendings know that, and they're usually really cool about it, and they'll let you take the shelf. I think is that it? Is that all the questions? Cool. If you have any more questions, just throw it in the chat.
All right, let's move on to Kern.
What's up, y'all? My name is Assam Hashim. So before I start talking about Kern Medical and Bakersfield, I kind of want to take a step back and just talk about how your third and fourth year is going to go. Just because when I was coming out of Barbados, I didn't know, and I was so confused. So like I came out during COVID time, so it was a little bit different, but it's still the same overall, like chronologically. You're gonna finish your time in Barbados. and then you are going to get scheduled for step 1. Okay. Once you take and pass step 1, the school will automatically know, and basically you're just sitting down waiting. Okay. I don't know how long it's taking these days because I haven't really checked in, but usually, okay, so about a month and a half after step, they will send you an offer and tell you like, hey, you can start in Chicago in 3 weeks. You can accept it or decline and say, I don't want to go to Chicago. I'd rather stay in California, which is what I did. And then they said, okay, well, if you really want to do that, it's going to take 3 months for us to get you started in California. If you choose to do that, you can wait that 3 months and nobody will argue, you know? Or if you choose somewhere else, you can just go somewhere else. Once you accept a location, they will give you 1 year worth of schedule. That's 6 different classes or rotations. The 6 are surgery, internal medicine, family medicine, psych, peds, and OB-GYN. Okay. You're gonna take, and everyone's gonna have a different schedule. I started with OB first. Mohammed, you said you started with surgery first?
Yeah, surgery.
Right. So everyone's gonna have like a different schedule, and you'll be like when I was on OB, most of the people that were with me, that was their last rotation. So everyone's gonna be sort of on a different track, like a different schedule. But you'll start your rotation. OB was 6 weeks. I'll have you you get 6 weeks worth of clinicals, meaning you go in, you report just like any other doctor would. Okay. And then at the end of your rotation, you take a shelf exam. That's basically like a mini. And these minis, we've been talking about it. They're 110 questions taken at a Prometric site, 2 hours and 45 minutes. Yeah, if you, I think the minimum passing score is like a 59 or 60 on like basically all of them, you know? As long as you can get around a 60%, you should be fine. And then like Mohammed said, most of the time you finish on Friday, you start the next rotation on Monday. And then you progress through all of your 6 core shelves. Once you finish your 6 core shelves is when you're allowed to start like taking your electives. You're sort of expected to take comp in step 2 in between 3rd and 4th year, but you can really take them anytime you want, so long as you've already passed 3 of your shelf exams. Okay. It's recommended to take them, like take like a small gap in your schedule to sort of dedicate some study time, you know, because step 2, I know everyone has always been talking about how, you know, you're not going to get into a residency without a good step 1 score, and that's the most important thing in the world. But as soon as you pass step 1 and you're in clinicals, nobody gives a damn about step 1. Everyone is only talking about step 2, and if you want to be whatever specialty you want to do, you better get a good step 2 score. That's going to help you sort of stand out above the crowd. Okay. So keep that in mind. We are not done testing. We are going to continue being testing for a long time. Okay. So you've taken your cores, you've taken your step, and then you start applying for residency, and hopefully we all match on the first try. Okay. And that's basically how it goes everywhere. So let's talk about Kern. I went at a weird time where Kern was having like contract disputes with Ross, so they sort of kicked me out mid cores. So I only did surgery, IM, and OB-GYN at Kern Medical, and then the rest of them I did at in Los Angeles, California Hospital. So I'm going to talk about both, kind of, okay? At Kern Medical, OB-GYN, they have residents. So it's kind of like a hierarchy, okay? So the attendings are there, and the residents are under them, and you're under the residents. So you're going to be the first one to go talk to a patient, and then you come back and report to a resident. And then the resident will sort of walk you through everything and then talk to the attending later just to confirm everything that they want to do, you know? Get good with your residents. If you have a resident there, they're the ones that can sort of talk you up to the attending and help you get a great letter. If you ever have like a disagreement with the resident, try to like de-escalate it, because if they don't like you, they will ruin your career. So be careful, you know, residents are your friends, you know. And that's usually how it goes. That's the hierarchy. In surgery, we don't have any residents, so you are reporting directly to the attending, which is good and bad. It's good because you have more face-to-face time with these attendings. You learn, like, you get everything directly from the horse's mouth, which is amazing. But if you ever not know anything, which is going to be common, you're not like a surgeon yet, so you're not expected to know what surgeons know. And they're going to test you. They're going to ask you different things, and some of them are nice about teaching you, some of them are not. So try to sort of be prepared. Like, for example, if you've seen a patient yesterday that has complications due to diabetes, go home that day and look up all the complications, all the different treatments, everything that could sort of happen, and go in the next day and impress your boss. um, and I think that's the best advice I could give, is just make sure that you know what's going on with your patients. That'll go a long way. And before you know it, these different attendings will be offering you letters. If they see that you're sort of standing out, you're showing up early, coming late, they'll offer to write you a letter. And you got to keep in mind that a lot of these doctors know each other, and even though, like, it doesn't seem like they do, but some of these doctors in Kern Medical will know some people out in New York, some people out in Florida, and they can make a phone call and sort of change your life. So you want to impress them. You don't want to cause any problems. And another thing that attending sort of talk to me about is patient care. Never fight with your patients, even if your patients are combative or like argumentative. Always remain professional, because if you are not, your attendings do not like that. Remember that we're trying to get into patient care for the rest of our lives. So if they ever see you arguing with the patient, they're going to ask you, like, what the heck, dude? Do you really want to be doing this your whole life? So make sure you're good with your patients. And then back to Kern. So for OB-GYN, you had both OR, like in inpatient, like in the hospital, and clinics. Internal medicine was the same. Surgery, for the most part, at Kern Medical was mostly inpatient, meaning you're just in the hospital all the time. Um, then I went out to California Hospital in LA, and I kind of got peds, psych, and family medicine, and I got lucky or unlucky, however you want to look at it, in that it was all outpatient for all three of those rotations. So I valued that because I got lucky seeing these different attendings in their clinics, and they sort of broke down like medicine, how medicine really is. Like frontline medicine is how they usually call it when you're in clinic. And they sort of teach you everything about money and insurance and everything that they don't talk about much in Ross. And I thought that was invaluable experience. So if there's ever a time that someone's offering you, like, hey, if you want to go to clinic, just go ahead, go, because you're going to learn a lot of things there that could help you decide what kind of doctor you want to be, because you got to understand, like, surgeons, their whole life have to wake up at like 4 a.m. They're expected to be in the hospital by 5, 6 a.m. forever. Whereas a family medicine doctor, he can work a 9 to 5, 5 days a week, and have just as much money. So you kind of got to sort of figure out what you want in life. And the only way to do that is to experience a little bit of everything. So I would recommend trying to get the most out of your rotations as possible. And once you get into your 4th year, you get to choose what to take. There's no mandated, I think there's like 8 weeks of internal that you have to have, but other than that, you can do whatever you want. So if you're interested in a few different fields, I would do a few, like, just pick those rotations. And it's okay. This is something I didn't know early on. If you're interested in emergency medicine, you can take emergency medicine in LA and then take another emergency medicine in Chicago. That's actually recommended. They don't want you to take more than 3, but they want you to prove to them that you want to do emergency medicine. You should take it twice, in different locations. That sort of is and if you can get a letter of recommendation from each site, that would be amazing. What else? Kern is amazing. I'm from Bakersfield, so I love it so much. I wish I could go back. People call it ghetto, but I don't care. It's a great patient population. When I say great, I mean they will not take any of the medicine you prescribe them, but I love them to death. Um, yeah, if you have any questions about Kern, um, let me know. We don't use Epic either. We use something called Cerner. Uh, I've heard it's like a step below Epic. It's better than the one I used out in LA. Oh my God, that's like from the 80s. Like the Windows like 95, like not a joking at all. I wish I can show you guys. It was crazy. But is Kern not an option anymore? Okay, so they had a contract dispute, but they've resolved that contract dispute. You can't schedule any current rotations from the website. You have to reach out to them directly, you know, and for your core rotations, you can request it from Ross, which is fine. But once you get to Kern Medical, you're going to meet a man named Abraham. He's sort of our guy, the Ross representative at Kern Medical. And you'll always reach out to him if you want more electives or if you want to switch your schedule or anything like that, you know. Reach out to Abraham and he'll give you a list of upcoming electives, like classes, and then you just pick and choose, you know. So that's all I have for Kern.
Thank you. All right, who's next on the list? St. John.
Hi guys, my name's Kayla. I did my 3rd year at St. John's. I'm now a 4th year, so I've been at like every other hospital since I've been there. So I have a little bit of perspective and being able to like compare different sites because I think I'm on my 5th site now, other than St. John's. So I personally love St. John's, but I will tell you to take that with a grain of salt because most people that go to St. John's do not like St. John's. But what I really liked about St. John's is I felt it really gave you the freedom to get whatever education that you wanted. If you know you really need a lot of time to sit there and study, by all means, like you could sit there in the library and study all day and just see your resident for like an hour and still get a decent grade. Or if you want to know everything, see everything, do everything, like you had that flexibility. So that's just kind of, and like the residents will let you like tag along with them. So it's like what I think is like really nice, and a lot of people, they're just like, oh, they just like don't realize that we really did have that flexibility to do whatever we wanted there. So I'll just talk about each rotation specifically, I suppose. So when you're in family medicine, there's a few different doctors that you can be paired with. There's one clinic that's right across the street from the hospital, and then there's one that's probably about like 20-25 minutes away. So if you're coming to St. John's, don't let them trick you into that you don't need a car because you can live, because there's an apartment complex that most students live in. It's literally across the street, but you might get placed in that clinic far away. So if you don't bring a car, make sure you request to be in the hospital or the clinic across the street from the hospital. But they do have family medicine residents in the clinic with you. But in the clinic I was in, I wanted to be super involved because I'm annoying like that. And so the attending would just basically treat me like I was an extra resident. So I would log into the computer. They use Athena and the outpatient clinic. I'd log in, review the patient's history, go get a full history, do a full physical, draw the patient's blood, and then go present it to the attending, and then she'd come in, see the patient with me, and then we'd send the patient on their merry way. So that's really cool because I was taught to draw blood. So that's how it is outpatient for family. And then for internal medicine, it's split into 2 6-week segments. So you do your first 6 weeks with the internal medicine residents, and then you do your second 6 weeks with the family medicine residents that are doing their in-hospital rotation. So it's like the same exact thing, except half are family medicine residents and half are internal medicine residents. On the internal medicine resident side, it's like, I don't know, like 8 to 4. And then on the family medicine resident side, it's like 6:30 to 4. And then there's like short call. So then depending how many students are in the rotation with you, it's like 1 day a week you stay until 7. And then you have 1 week of nights. And then you have like 1 or 2 shifts on the weekend. So you might have like 1 week that's a 6-day week. So that's internal medicine. You're mostly with just the residents there. The only time you really see attendings is when you give your weekly student presentation and then on morning rounds, but morning rounds are usually like only 30 minutes to an hour. So you'll be expected to just like present one patient. The resident won't necessarily tell you to present a patient. So I'd say always just pick one ahead of time if you're there, and then ask the resident if you can present it, because then it like gives you the opportunity to like make face with the attending. If not, the residents will just do the whole list and then you just get to watch. But obviously to better yourself. But then like you do have a lot of time in the day to continue, like you can read all of the charts, and I'd always just read them over and over again to really understand the patients. And you really learn the orders that way. But also on our internal medicine rotation, we have a sim lab. I know it went away at St. John's for a bit, but I think it's coming back. So we were all required to take it was like a week-long class. We learned to do IVs, blood draws, Foley's, ABGs, NG tubes, and then airway management. And then we got a sticker on our badge that we were all allowed to just like do those. Like we didn't have to be like supervised or whatever, like we were now certified to do them. So it became really helpful when the nurses don't draw the labs. You could just like, oh, I got this. And then all of your patients have their labs and you're not like spending your whole day calling to get people to draw them for you. And then surgery is also a residency there. So that's like 6. It really depends how many students are in your rotation. They don't have very high acute, like high complex cases there. They're pretty much like the bread and butter. So you get really good at like lap choles, like watching, like you really understand lap choles, lap appies, things like that. The residents will like let you go with them. They do a lot of central lines, so you can see a lot of those. Wound vacs. You get really familiar with doing like the intern things that a lot of people don't like, and students don't get that experience at other hospitals because they spend so much time in the OR. And so now that I'm at other hospitals, I can like do all these things interns are expected to do. And I'm like teaching the interns because they're like, this intern doesn't know how to use a wound vac. Can you show them? Things like that. So like, I'm really grateful for that experience because they really like, obviously I'm not going to go in my first day and be expected to do lap chole as an intern, but I'm going to be expected to manage a wound vac. So I think it gave a lot of experience in that regards. And then psych is you do 3 weeks inpatient, 3 weeks outpatient. And then when you're inpatient, they do have a psych ED, which I guess there's only like 6 of them in New York. So it's like a pretty big deal. And there's a really big mental health crisis essentially here in Far Rockaway. So people will, so you see a lot of really sick patients, like most of just like the regular patients in the hospital have like psych issues. And what else? Oh yeah, pediatrics. So for peds, in the morning, you go to the hospital, you round down all the babies. There's usually like 5 or 6 of them. There's not very many babies born there. You do that with the neonatologist, and then he does a lecture with you. And then after lecture, you go to a clinic, and it's just like family med. Like you see the kid, do the whole everything, write the note, present it to the attending because they don't have residents, and then the attending goes sees the kid. OB-GYN, it's like split up. Each week is different. So like 1 week you're on L&D, 1 week you're on GYN, 1 week you're on the clinic. But it's like a slower OB situation. So like I've heard some people like will only see like 1 or 2 babies their whole time, which is not a lot. Yeah. So it's like they were there 1 week, that week no one had a baby, so they didn't get to see a baby. So that's St. John's. I don't think I missed any of like the core rotations. So if anyone has any questions, I see some people were typing, but they didn't seem like they were geared at me. Yeah. So yeah, if you have any questions about St. John's, I'm happy to share more information, but that was my experience overall there. And just so you are aware, St. John's is a pre-match program. So all of their residencies at St. John's offer spots outside the match. So if you don't know what that means, is they will send you basically a residency offer before the match, and you have to withdraw from the match. So like even the competitive ones are pre-match, like their derm program, their ophtho program, their surgery program. So, I mean, if you are looking for something more competitive and don't care about like how fancy the name is, it's a way to get your where you want to be in life. Okay, that's all.
Thank you. Okay, next up on the list is me. So I'm at Western Reserve Health Education at Trumbull Regional Medical Center in Warren, Ohio. I know Ross just listed as Western Reserve. It's not Case Western because Case Western is actually University Hospitals, and Western Reserve is actually its own hospital outside of Akron in Cuyahoga Falls. So it's not there either. That being said, this is a NeoMed program, so it is at Regional Medical Trumbull Regional Medical Center in Warren, Ohio. Warren, Ohio, the best way to describe it is like kind of a rundown city in a way. It was really populated back in the day, really upbeat, and it's just kind of, you know, worn down a little bit. There's multiple hospitals within this area, so this isn't the only one. It's definitely not the only one you'll be going to if you're at this site. So I started in September of last year. I started in internal medicine, which I thought was a really great starting point for me, at least. And I was really happy that I was starting in internal medicine. The program there is pretty IMG friendly. They take a lot of different IMG, especially the internal medicine program. They do a lot of couples matching there. So if you're interested in internal medicine, then you know, have a spouse, that's a good option. But anyways, it's a pretty big program. So they have anywhere between, I think, like 12 and 20 residents in a class. So I genuinely didn't know everyone from the internal medicine program, but at least the residents that I was paired with. So you're paired with a resident each week. It could be the same resident depending on, like, if you're on floors, for example, the next week. So I was with the same resident for the full week of September. And then I went to ICU. So it was like, you know, paired with a different resident. Then you go to Palm, cardio, all that jazz. So you get paired with a new resident. I had a really great group of residents that I was with. So I have like genuinely no complaints on my internal medicine rotation. It was to the point where like I was questioning if I really wanted to go into internal medicine because I had that great of an experience. So if you go there for internal medicine, you have Team A and Team B. With that being said, Team A rounds in the morning, Team B rounds in the afternoon, and they're two different groups of physicians. And Team B is predominantly like your teaching team. So that's the team I was always on because I always wanted to be taught. A lot of them do either table rounds, and then they did like questions afterwards, or they did like floor rounds. So they taught you a lot of like hands-on stuff. I really loved my internal medicine rotation. Monday through Friday, report time is 6:30. You have 7 o'clock didactic morning lecture, Monday, Wednesday, and Friday. Noon conference every single day. They're all taught by different people, so you're also required to attend those. Most of my days, like I would get done in internal medicine around 4 or 5, depending on which service I was on. Palm, I stayed longer because we did a lot of different things for Palm. Kind of the same with what everyone else is saying. Build a really good rapport with your residents, build a really good rapport with your attendings. They're gonna let you do a lot. I was always presenting, always asking me questions. I even got to like tap people because I just showed interest in wanting, you know, one day I was like, oh, can I do the thoracentesis? And my attending was like, yeah, sure, go for it. So just, show engagement. They're going to let you do a lot of things, honestly. So then I went into surgery, which was right during ab site time. So it was kind of rough as far as teaching wise. My biggest advice is if you're with residents versus the attendings, which you're with both, but you're predominantly with the residents for surgery, is to kind of stick with your, fourth and fifth years if you can, especially in the OR room, because they're going to teach you a lot because your interns are doing like other things. I stick with the interns like if I was more so on the floors because they're going to teach me a lot of things about like wound dressing, all that jazz. So that's how I did it. Making sure you know where all your supplies is, I think, is one of the biggest things. So for us, like trauma call, surgery, the surgery team, went to trauma since we're only a level 3. So I would just like get all the supplies and everything, make sure I knew where it was, whether I had to go to the ICU to get it, whether I needed an ultrasound, all that stuff. Just know where your supplies rooms are, how to get into them, what you're looking for. I think that's my biggest thing. Carry the supplies in your pockets on morning rounds, or like we had an actual bucket we just carried around that was already filled. Any questions? And then I went to, where did I go to? OB. So if you're interested in OB, I would genuinely tell you not to come to this site. And the reason I say that is because you will not get an inpatient experience. You will not get one. So it is strictly outpatient. It's in a underserved community clinic, which I absolutely loved. I absolutely love the population diversity we served. You run the clinic. So that is one thing, you don't get the inpatient, but you run the outpatient clinic. So you're charting, which is paper charts, by the way. Paper charts. You see all the patients by yourself. You do all the exams. Like you do everything. The only thing you genuinely don't do is ultrasounds and colpals. That's it. Everything else is you. You need to know ICD codes for mammograms, biopsies, like pelvic, ultrasounds. You need to know all of that. You're the one providing the information. You're the one telling the doctor, okay, we want to run this test, and this test. They have an in-house lab. So, you pretty much ran the show, and he'd be like, okay, yeah, I agree with you, or no, I don't. And most times, like, he would go in, he'd be like, do you have any other questions? And they'd say no, or, something along those lines, depending on the situation. You broke bad news to patients. A lot of people coming in, testing positive for STDs, finding out their spouses are, infidelity, things like that. I've had to do that. I've had to deal with some really rough cases as far as like in the pediatric population, as far as like, pelvic exams for young girls that are going through a very hard situation. What else? You will work with a nurse practitioner there too. You fill out all the scripts. I think that's it. So you just don't get an inpatient experience. I got to go into the hospital once. He snuck me in after hours for a C-section, which was absolutely amazing, but that's not all the time. And it's not that he can't, because he's tried. The school has tried. Mercy just won't let us in. Both the hospitals that do deliver in this area are Mercy owned, and Mercy just won't let us in. They won't even let the family medicine residents in to work for their OB rotations with their actual program director, who does predominantly OB. So like they have to go to like Pittsburgh to do it. So they just won't let anyone in. So it's not going to happen. So if you want to go into OB and you really want a good experience, I genuinely would suggest to go elsewhere. And then peds, all outpatient. Dr. Adekunle is amazing though. Again, he lets you run the show. He'll let you follow him around for like the first day or two, kind of get the hang of things, and then you'll start going in and doing it by yourself and coming out and presenting, the patient or patients to him. All outpatient, no inpatient. So with that, but again, you learn a lot because everything's like hands-on, everything you're doing a lot. You have a lot of autonomy. Family medicine is with residents as well as the attendings. The attendings are amazing. They give you a lot of autonomy. You go see the patients on your own. You report it back to the attending, and they kind of ask you, okay, what plan you want? And that's normally the plan they go with, to be honest. Residents, some of them are really chill. Some of them are like, okay, go home. Some of them are like, okay, no, you're going to stay and learn. It just really depends. We also have 1 week at inpatient for family medicine, which for me was really chill. It started at 5:45 in the morning. Oh, for surgery, I forgot to tell you what time we report. So surgery, at least when I was there, I got into the hospital at 5 o'clock. I rounded on my patients. Sign out was at 6. We had to present at 6. And then you rounded, and then you went to the OR or did whatever you had to do for that day. Right now, I know it is fluctuating between sign outs at 5. So if sign outs at 5, that means you need to be in the hospital between 3:30 and 4, depending on how many patients you need to see and round on. Or 6. It just depends on what the chief wants that day. And I know it's fluctuating between a couple different people right now, so it's just really dependent on what they want. Sign out was usually between 5 and 7, given the day. Wednesdays, you had student didactics, which was like afternoon clinic, which could be anywhere from 3 to 5, 2 to 5, or nothing at all. And then you had didactics with the residents on Thursdays. And then what else? Psych right now, there's no residents. They are opening up a residency program next year. There's a lot of psych in this area. Same as New York. So there's a lot of psych, a lot of schizophrenia, a lot of psychosis, a lot of mood disorders. I'm in it right now. I absolutely love it. I love psych. The days are very short. It's like 8 to 12 max, 8 to 1 max. But you're doing all the follow-ups. You're seeing all these patients. You're rounding on all these patients. You do all the consults. You do all the new patients. So you do a lot of work in those 4 hours, but that's it. You do the work and go home. So I've learned a lot. It's really about being able to like talk to people and just kind of figure out what's going on with them. Other than that, again, finish on a Friday, start on a Monday. No breaks. I think that's, yeah. Did anyone have any questions about that? I might say we do road about other IMGs. We have AUA as well as Neomed is here too. All of the residency programs here, like I said, are IMG friendly. There is research available at my site if you ask. Not everyone is doing it, but they do it. And you also have to like know them. They have to know you, because if they don't know you well, or they're like, they're not going to give you research even if they like have it to give. As far as kids wise, I honestly don't know how kid friendly the site is. No one that I know has kids. Not many of the residents I know have kids, besides for the one. So I just personally don't know how kid friendly it is. I think that's it. If anyone else has any questions, just drop them in the chat. If not, I think Michigan was next.
Okay. Can everyone hear me?
Right, guys, it's the two of us. There's two of us.
Yeah. So, my name is Eros, and my wonderful colleague here is Kayla. So we have like a mini slide that she's gonna go over. So
Let's see if I can share.
Yeah. While she tries to do that, I can just talk a little bit about the other core rotations. Yeah. So the slide was mostly for just surgery. So yeah, we're kind of like making it special. So we have all the cores. We have surgery. We have psych. There's OB. There's PITS and family. So for SGMO St. Joe's, and the name is changing to Trinity. Trinity Health, so it's pretty much the same thing. So St. Joseph's Oakland Mercy is currently changing to Trinity Health, so don't get confused if that pops up. Yeah. So for predominantly, most of them are inpatient. So surgery is inpatient, OB is more inpatient, the whole of psych is inpatient, and family and PEDS are the two predominantly outpatient. You're gonna get like a week here in and out for some of the surgeries for outpatient, like you get a week of clinic for internal medicine, and you also get a week of clinic for OB. Then for surgery, depending on the subspecialty and the attending, you go with them to their clinics or their office. Or the rest of it is it's inpatient. And I think it's public. So I'll just let her go over all of this and then I can continue after that.
Okay, you guys can see my screen because I can't see you. Yes.
Yeah, we can.
Okay, awesome. Let me go back then. We just threw this together really quick just to kind of like tailor it specifically to surgery. So I'm a fourth-year medical student at Ross. Obviously, did all my courses at SJMO, also called Trinity Health Oakland. They had a new name if it's confusing. I have taken step 2 and have taken OET. I feel like our site is really, really good for studying. A lot of students pass comp on the first attempt at our site. A lot of students do really well on shelf at our site because it's not nearly as demanding and it's a smaller hospital than some of the other Ross sites. So Trinity Health Oakland is like a bougie private community hospital where they give us a lot of breaks. So we have, I think, like a week and a half or 2 weeks for Christmas, and then every July. So when the new residents come for July 1st to July 17th, they give us off 2 weeks. I will say, although it's nice to have extra breaks, it does affect your requirements for graduation. So I have ERAS and stuff on my mind, so I'm just going to talk a little bit about that too. So going really quickly through the surgery core rotation, 12 weeks, like Awo said, broken down by general surgery, trauma surgery, vascular surgery, cardiothoracic, surgical ICU, and surgical pathology. McKinney week is a really, I think he's really cool, a really hardworking, crazy busy general surgeon here, and it's kind of like a hell week that we all get here for 1 week. And then at random, you have either 2 weeks of one elective for surgical electives and 2 weeks for another. Those are orthopedic surgery, colorectal surgery, plastics, neurosurgery, ENT, and breast. I just forgot to put that on there. You guys can read a little about the core details. So usually Monday through Friday, 6 a.m. to 3 p.m., although you have to do cover shifts, which are assigned to yourself, and you would stay till 6 p.m. You get weekend shifts at our hospital and 1 week of nights, which is kind of crazy because you start on Monday and then you end on Sunday morning. You have one kind of a half day to turn around. M&M stands for morbidity and mortality, which is a really huge portion of general surgery residency, kind of going over the cases that maybe had patient mishaps. We get to be a part of that, and resident lectures are given every Monday. Also, SJMO loves to kind of have the family aspect. So students actually designed like a student-led orientation for general surgery that was started by me, as well as other people who did like more practical surgery technique orientations. So we kind of just let the students come in on the Sunday before they start and kind of get them oriented to the OR because it's a whole different environment. At our site, there's plenty of opportunities for surgery to get exposure, but it's kind of like what you get out of it is what you put into it, and that's kind of what the residents will tell you too. So if you want to coast, you definitely can. Oh, I don't like surgery. Okay, I'm not going to do that much. Still be a team player, but if you do like surgery and find interest like me and Awo did, then you definitely can be a shining star. Some important information that I thought that was really helpful, especially if you're trying to like gun for surgery and you like can't think of anything else besides surgery, is to maybe start thinking about where you want to get your letters from. So at SJMO, there's actually really strong affiliations with surrounding hospitals. So going off that, the program director is Dr. Amy Braddock. She's really, really awesome, and she's a female, super approachable. PD letters are awesome. Department chair is Dr. Schwartz. So Dr. Braddock and Dr. Schwartz actually trained together at Beaumont Health, which is a really prominent hospital in Michigan. These are just little important things. So say if you wanted to stay in Michigan for residency, kind of getting your name out there and having more people know you and have a strong affiliation with you can maybe get you that residency spot. Dr. McKinney is also associated with U of M and Cleveland Clinic. You are evaluated by 2 of the general surgery residents, and these can be used for your letters if you had asked them for attending. And most surgeons we work with are also designated to work at DMC, Detroit Medical Center, which is a huge university hospital, and Beaumont Health. So again, more exposure and bigger names. A lot of research opportunities at SJMO. I don't know what's in the water, but there's a lot of rare cases. Even in the pathology week in surgery, and even in the pathology elective, which is what I'm in now, surgical pathology, there's a lot of case reports that you can get and opportunities for presentation and publication. One little small thing I want to touch on is that if you do orthopedic surgery and plastic surgery within your surgery elective, like surgery core, so while you're a third-year student and you say you really liked it, you want to come back and do a fourth-year elective in plastic surgery and orthopedic surgery, that would be with the same physicians, which is really good if you want to like get a letter from them, so there'll be more exposure to you. And that's pretty much it. There was a lot of information. Let me stop sharing. Okay.
So that's pretty much it for surgery. And I know I think one thing we're also starting in the site is, like Kayla talked about, the student-led orientation, and we do that like the day before. That's a Sunday before the rotation starts, and we also have an introduction to the OR on the day, the first day of orientation, where we'll go with students, kind of like have like a student-led simulation. But we do have like a staff there. One of the doctors here, I'll call it Dr. G. It's part of the process. She runs all the simulation for everyone, all the residents and the students in the hospital. So she's present, and then we teach the students how to scrub before their official scrub class, so they don't get left hanging their first day of walking into surgery and realizing they haven't done their scrub class and now they have to scrub it. Yeah. So pretty much that for surgery. So for the other core rotations, I think that's like across the board is like one of the more friendly rotations in terms of residents and everyone. And we also have a few Rosses who are also residents currently going to their second year. I don't know if there's any new ones that came with this first year in SGMO here. And yeah, like I said, you get 1 week of clinic, and the clinic is just by the hospital. Most of the clinics are by the hospital, apart from family medicine and pediatrics, where you have to drive farther, or during surgery when you're with doctors who have clinics outside the hospital. And for a majority of the surgeons who have clinic and you work with, they are still within the hospital building. So for most of the time you're here, you really won't be driving to a different location other than going to the hospital. Then for psychiatry, same thing. The hours are actually pretty great. You get there sometimes, yeah, at this point. So you get there at like 6, sometimes 7. And if you leave at 11 o'clock, that is like a super late day. That's like a day where you have like so many patients. So most of the time you get out at like 10:30, sometimes 9:30, and you get to see the patients, you get to talk to them. It's inpatient, so you go see you. The downside to that is you probably won't see some of the other illnesses that might be outpatient, like eating disorders. You won't see those because they don't get admitted because of those. But you're gonna see like schizophrenia, bipolar, like major depression. You're gonna see all of that. Then I haven't done pediatrics and family yet, so I might just leave that for Kayla to go over that since she has gone through all of them. I'm currently in my OB rotation, which I'm on my gyne week, which is pretty much kind of like an extension of surgery because it's just hysterectomies and all of that. So I haven't done labor and delivery also, so I'm gonna leave Kayla to go through all of those. Yeah.
Okay, so pediatrics is 3 weeks. I mean, it's changed since I've been in it, but it was 3 weeks outpatient at a surrounding clinic, and then a NICU and 2 weeks of inpatient peds, I believe. Really nice pediatricians, very understandable and nice attendings from what I can see, from what I had experienced. The NICU is a little intense, but it's the NICU, so that's expected. Family medicine, unfortunately, is completely outpatient, although I was placed at a really big, high volume clinic, which was really popular in Clarkston, Michigan, if anyone's familiar. It was with Dr. LaJoy and his wife and a couple of other attendings that are, again, associated with Wayne State and Michigan State University School of Medicine. So there's some alumni there if those are important places for you. I will also mention like some things about our hospital. So back to it being bougie, I think we're like, correct me if I'm wrong, the only Ross site that has a student lounge that's actually pretty considerably big and you can actually study in it. A lot of people get really surprised when they come and rotate at our side. They're like, oh my God, I can't believe you guys have this, like a place to even like put your stuff. We have lockers. we have like a whole lounge that was once a library dedicated to us where you can study, and it's relatively quiet at some points of the day. There's a bunch of computers in there. We use Epic. We have Epic access. You sign in with your card. Parking is really convenient. It's right on site. You walk across the bridge. It's free, and you get in with your card as well, your ID. Yeah, anything else we can think about? There's a gym that we have access to. A lot of the medical office buildings that are associated with the attendings that you'll be following are like right on site. They're attached to the hospital, so you don't necessarily have to go like all over Michigan to follow them, which I thought was really nice. Anything else we could think of, Avos?
Not really.
Also, our student coordinator for Ross is very, very involved. I feel like that's another beneficial thing, because at other sites, some of my friends don't even know the coordinator. So we were trying to get maybe like an elective for 4th year reduced or added on for a week. Her name's Kristen. She's a little too involved in our lives, but at the end of the day, it's pretty good. It's beneficial to us, and at least we know who our Ross coordinator is. So
Yeah, she's super. She sends reminders to make sure you have all your kids logged in, just to make sure you get all your 10% for your core rotation. She sends a reminder like almost every week, which is great.
yes,
You know,
which is great, but yeah.
much else. Well, yeah. Overall, yeah. Like Hilla said, it's very bougie, and it's also, yeah, it's very friendly. Like what you put into the rotation is what you get. Some rotations are more friendly than others. I am obviously surgery not as much. It will be kind of like in between. And sometimes you work with residents, and sometimes you just work with the attendant. And the attendants are really nice to the students. Even the surgery attendants, they don't yell. They won't yell at the student. Yeah, they might, if something happens to the resident, they might go off on the resident, but they never transfer it. They never transfer it to the student. Yeah. So
one last thing before I go, I'm just going to say about the affiliation. So what they take for residency from Ross. So they have taken Ross students for radiology, OBGYN, and IM. Not surgery friendly, not IMG friendly. But the radiology program is really awesome. And we have anesthesiology residents from Ross as well. So if any of those are maybe piquing your interest, I would try to like put that on our radar for 4th year electives. That's it.
Thank you. I think the next hospital is Miami, the Miami sites. Sorry, I'm trying to go back to the chat.
I think there's 3 of us here. Can you hear me?
Yeah, we can hear you.
Good evening, everyone. The other 2 people who are also from Miami, please feel free to introduce yourselves as well. Chime in, because everyone's experience is different. But my name is Jamala. I am in a weird limbo now. I am technically done. I've done OET, CSA, all of that, and I'm just working on applications for this upcoming cycle. But I can talk to you about Center for Haitian Studies. If you're not familiar with the Florida tracks, we have 3 down here. It's Center for Haitian Studies, Miami Rescue Mission, and Cleveland Clinic. And Center for Haitian Studies, actually, thank you, Tequila. Center for Haitian Studies is primarily based in the Jackson Health System, as well as Stewart Hospitals and Broward hospitals. There's other hospitals as well, like HCA, where you may rotate, but those are the primary ones, especially Jackson. So I can quickly go through the clerkships I had while we were going through this. I'm sorry, I wish I had a presentation. You guys did a great job before me, but I tried to jot down everything that I could recall. So I started with family medicine. It was in an outpatient clinic. Like you've heard from most people already, family medicine is a intense rotation because it's just so broad. And if you're in a private practice, you're going to see a lot of patients, and it's going to be like a shock to your system, like, oh my goodness. But you learn so much. And yeah, I thought it was great. Then I had my pediatrics, which was outpatient. Then OB-GYN core. I did 2 weeks in labor and delivery nights. And then the other half, or the other portion of my OB-GYN core was inpatient and outpatient. So basically, I was with an OB-GYN who had his own practice with other nurse practitioner and another OB-GYN in there. And the practice was adjacent to the hospital. So we would be in his office from 8:30 till 5. And sometimes we would run over to the hospital because he had a C-section to do, or different procedures. So it was a nice mixture if you're actually interested in OB-GYN, which I was not, but I liked being in the OR. Then I had, after OB-GYN, psych. Most people will tell you that psychiatry core is going to be the most chill rotation you've ever had. I definitely was able to study for internal medicine, which was going to be the following rotation, while I was in my psych core, simply because it was a really lax schedule. It's a great specialty too to consider for people who know that they don't want to do surgery or anything else, because even in residency they have a very chill schedule. So that should tell you this is going to be a nice rotation. But some people do end up in psych rotations that aren't that relaxed, but the majority end up in nice ones. Then after psych, and I had psych and OB-GYN at Jackson Memorial. So just so you guys get familiar with the Jackson Health System, it's one of the largest down here. They have multiple facilities. So whenever you hear like Jackson, Maine, it's actually Jackson Memorial Hospital. That's the one that's adjacent with University of Miami Hospital, which is literally right across the street. That's where Ryder Trauma Center is, where you actually do rotate as well, which I'll describe. They also have Jackson North, Jackson West, Jackson South. So there's multiple facilities that you'd be able to rotate at. But back to where I was before. So then I had my medicine core. Medicine and surgery cores are each 12 weeks long. So medicine, I did inpatient, rotating directly with attendings and residents. And the responsibility was there. Like as a student, you would go and see the patient, if there's any consults or anything, and then you would do early morning rounds with the attending. The other part of my IM core was also spent at another hospital, which was a Steward hospital known as North Shore. And then was my surgery core. So the order of which you do rotations will vary from person to person. And I actually preferred the order I had because I feel like by having family first, it introduced me to everything, because you got some peds mixed in, you had OB-GYN to an extent, and then surgery for me. I feel like once you get to surgery, like if surgery is on the back end, you've got so much experience going through rotations. You're not like awkward. Some people have surgery first. It's doable, but just to give you a heads up, it's not always the same order for everybody. So my surgery core was done at Jackson Memorial Hospital, the main hospital. It's at Ryder Trauma, which is a level 1 trauma center. I had an amazing experience there. I'd always wanted to rotate there, so it was kind of like really cool. The residents, you spend a lot of time with them, but you also get a lot of face time with the attendings as well. And there's optional 24-hour shifts. I know some other hospital sites have mandatory 24 hours, but in Miami, I will say they're respectful for the most part of students' schedules. Like the attendings, the residents will be telling you, get out of here. And I think Kayla called herself a nerd. I'm also that nerd. Like I was never the one who was just sitting back, taking it easy. I'm like, no, I'm staying longer. Like being that word person, just because, when you really enjoy something, you want to get the most out of it. One, we pay for this. Two, it's what you want to do. So it's like, what's a long day? No, that's not long. So I did trauma. It's very hands-on in Miami. One thing I have to stress is that if you have a badge and passion, they will let you do just about any and everything. So in trauma, you'll be in the resuscitation bay, seeing thoracotomies. You're in there. You're not just standing on the sidelines. You're actually in the resus bay, like flipping patients. My colleague, he was a respiratory therapist before being in med school. He was over there intubating this patient and everything. And I'm like, hold up, I haven't even done my anesthesia elective yet. So they make sure that you're really involved. Suturing, people come in, crazy lacerations, everything. You're there doing primary, secondary survey. They're teaching you fast, everything possible you're doing, Foley's, NG tubes. So it's very hands-on, and I chose to do a 24 hours, so I got to go on the helipad, and it was a lot of fun. And then the other part of my surgery core was with two different general surgeons. One of them had a fellowship in colorectal surgery, so he does everything as well as some colorectal cases. And then the other one was a military surgeon, and she also has a wide array of things that she did. But some students also end up in either transplant surgery, plastic surgery, cardiothoracic surgery. So if you have an interest in any of those, you could even ask CHS, or Center for Haitian Studies. And that's another thing I can say about this site, is that they try to work with students, not just based on where you reside, to find a site that's close enough to where you are, but also if you have a specific interest, then they'll say, okay, let's try and get you more exposure with that. So those were the courses, rotations I had. Let me run through my little notes here. Like everywhere else, it's what you make of it, no matter where you go. So any site, everyone has said this before, you're gonna have some students who are just like, give me the easiest rotation, or I'm not really interested. You're all here at this meeting, I would assume, because you're pursuing surgery. And something Dr. Rudnicki always tells us is that surgeons are leaders. So we're not going to be the ones just sitting back and taking it easy, loafing. No, you get the most out of every core you go through, every rotation, give it your all, because there's something that will be applicable to your surgical career. Another thing, the preceptors and residents are super helpful. They're willing to teach you. On trauma, you'll actually be in the morning rounds with all the clinical faculty of that residency program. For me, it was like daunting. I'm like, oh my gosh, I don't belong here. And they'll actually ask your input and everything. And so it's super cool. When I was there, I actually met a Rossi who had matched. She was a PGY1 at the time. And somebody who I completed my surgical core with, he's an SGU student, but he just matched there. He just started there this month. So you might hear people say, oh, they're not IMG friendly, but they are. It's what you make of it, though. I already told you that CHS tries to work with people. Miami, compared to a lot of other states, is like laissez-faire, like, just like the reputation we have of being laid back and stuff. It's kind of like that, not as structured. We do not show up in professional clothes in Miami. You come in, you're in your green scrubs. That's your professional clothes. I actually had to, when I did my surgery sub-I in Baltimore, it was like a shock to me, because I'm like, oh, I got to dress up. Okay. But it's super cool here. Everyone's super helpful. I know somebody talked about what time they reported for surgery. In trauma, the expectation was like morning rounds by, I think, 5:30, but I would just show up to the hospital every day by 4:30 out of my own preference, because the expectation was that you're going to come review the charts pre-round on your own, get familiar with the patients, interview patients and stuff. Then I would present it to the residents, and we would round together. Then we would round again with the attending. And after that, we would take care of stuff on the floor, and then go to the OR for different cases. CHS has other students also that they place down here. So students from AUC, SGU, also some NOVA students, and University of Miami students. We don't rotate directly with them, but we are in the same vicinity as them, at least in trauma. Residents are always doing research. That's something to consider, like if you want to pursue academic surgery, like the site that you're at, do they offer a research year to their residents? If so, then their residents are always doing research. And then I found, while I was going through clerkships, I found it was pretty flexible, like with my schedule and stuff. I did not take dedicated time off for step 2, which in hindsight, I'm wondering if I should have. But actually, no, I feel like I took a lot of time for step 1, but step 2, what I did differently is I scheduled my electives, like the ones that were closer to my exam date, I made them something simple. Like I wasn't gonna be like a IM sub-I or any type of sub-I. I made it like something, that I knew wouldn't be too bad. That's just something to consider. And then shelf studying, treat it like it's step studying because it really is. So someone was asking, I think before, sorry, I haven't been looking at the chat, but someone was asking like about studying for shelves in step 2. I exhausted UWorld for every single shelf. Like I did at least 2 passes. I was going through UWorld like crazy as if I was taking step the following day, because the reality is like, it may sound like, oh, I have more than enough time to go back through it, but you don't want to be trying to figure it all out in dedicated. You want to be refining by the time you get to the dedicated time. But UWorld is golden. Do as many questions as possible. That's the best advice I could give. And if I had to compare my step 1 to step 2 experience, I did a lot more questions. So yeah. Let me see if I can look at the chat. Does Jackson Memorial have an anesthesia rotation? Yes, Kayla, great question. So it was actually Jackson South, which is a part of the Jackson Health System. They have an elective, which I did complete. So someone was talking about the beauty of 4th years, that you can schedule electives based on what you're interested in. So I'm personally interested in general surgery. And I knew that at least one skill I wanted to develop was how to intubate. Will I ever have to do that? No. But did I want to do it? Yes. So I went to Jackson South, which is the Jackson Health System in general. Miami in general, they're very hands-on. Jackson South, they are like every single operation that's happening today, you can intubate. If you don't feel comfortable, that's okay. You can stand here, we'll teach you everything, But for me, I was like, sure. So left and right, I'm just intubating. And what was also neat about doing an anesthesia elective is you see a wide variety of procedures. So I saw ortho cases, colorectal cases, bariatric surgery. It was like all these things I hadn't seen before on my surgical core. I got to see them all in anesthesia. And in addition to that, I was able to push meds, intubate patients, do the whole process. So yes, to answer that question, yes, anesthesia is definitely great. And you will never forget your first thoracotomy. Yeah, you're so right about that, because there's going to be some things you'll see, especially in surgery and OB-GYN, some things that'll really have you like, wow, it'll stick with you. And I can tell you gun violence stories, motor vehicle collisions, like a lot of those are the stories that really are just like, dang, especially when you see someone who's very like your own age or younger, it's like crap, But it's a really intense scene, great learning experience, but it's also unfortunate for the patients. But yeah, that's what I can say. The other 2 people, please chime in. Tell us about your experience down here. I don't remember who it was. Maybe they're like, that pretty much sums it up.
All right. Well, thank you everyone for sharing your experiences. Does anyone have any like last minute questions that we didn't answer? Or things you would like to know? If not, I think we can wrap it up. You know where to find us. Don't be shy. We'll answer any of your questions. You can drop it in the group chat. You can text us individually. You can, email us. We'll all respond. We're all super friendly. We're all over the place too. There was a number of us here that are on the board that are, at different sites that weren't able to make it tonight. So if you are interested in some other sites like Jamaica or, St. Agnes, like the Baltimore tracks, like we have some people there as well. We're all over the place, and a number of us also are in 4th year, so everyone's traveling everywhere, as far as also to like non-affiliates. If you have questions about like the non-affiliate process and how like they went about, getting those electives, you can, ask them. Other than that, have a great night. Thank you everyone for showing up, and thank you to the board members for joining and speaking about your tracks.
Thanks everybody for coming.
Yeah. And to answer that question about the clinical portion of the new sites opening up, Ross might not even tell you that information, to be quite honest. I'm just being straight up. They probably will not tell you that information. But good luck. You might get an answer, but I tried and I didn't get anything. So.
Also, we have group chats for basically every site. So if you know where you're going or when you find out, you can reach out to somebody on the board and we will direct you to that group chat, just so that way you can sort of be involved even before you get there.